My name is Kelle Berggren. I'm a dermatologist with DuPage Medical Group. Well, it's about a year ago now. We just had come back from spring break. We were in Cancun, Mexico for spring break. Went through the whole month of April. There was nothing. Then one Friday night, I was changing into my pajamas for the night, and my husband said, "Kelle, where did you get that dark mole behind your knee?" And he's heard me at parties, to different friends, people asking me about skin cancer, what kind of moles should I look for, and I always tell them the black Sharpie marker, the dark spot, the mole that just appears, one that's acting a little bit differently. So all those times he's heard me talking to other people helped him out quite a bit. So I automatically went into the bathroom, took a look. It was in the crease of my left knee, so it would have been nothing I would have noticed. My heart just dropped. I figured this is exactly what I see when I see melanoma in clinic, and I thought, boy, here we go. So I biopsied it, got back the results the following Wednesday, and our pathologist gave me a call, and he said, "Kelle, it's not good, it's a melanoma, but we caught it early, it's a stage 1. So, and that basically just got the wheels turning, and had it cut out that afternoon. Actually, this is power of our dermatology network. Being in the back of my knee, it was so large you can't stitch it, so it was left open. So it was a wound about this size, and it just kind of closed from the sides and from the bottom, and it was pretty much closed by the 4th of July. So my husband did a great job of helping me with the Band-Aids, and I did not take one day off of work, because I figured, why would I take off work for this when what I do all day is diagnose skin cancer and melanoma? So I needed to be where I was. I just kept telling myself what I tell every patient that I've had, that I have had 2 patients die of melanoma in my career as a dermatologist for the last 15 to 20 years. So for the most part, the diagnosis is by no means a death sentence. It's just, hey, I have a history of this, I'm gonna get it taken care of, I'm gonna get my skin exams, I'm gonna watch how much ultraviolet exposure I get, I'm not gonna touch or look at a tanning bed. Getting your skin exams yearly is huge. Once you have skin cancer, whether it's basal cell, squamous cell, or melanoma, then we see you a little bit more frequently. But at least getting in yearly for those places that you can't see, and for our eye catching it. I still go out in the sun, I still go on spring break, I still am at my kids' soccer games and everything. You just have to be smart about it. The top 3 things are wear SPF 30, apply it before you go outside and often. 0 tanning beds, and sunscreen clothing, and seek shade. Probably the most important thing though is keeping those skin exams on the schedule that we let them know, and cutting out anything that looks strange, because we do, having a melanoma history, have a higher chance of getting another one. You know, we have an eye for it. The dermatologists in our group, the derm PAs, the nurse practitioners, we see thousands of moles every day. We have an eye for it. We know what to pick out. We know what looks a little different.